Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, with another of our COVID conversations. Today is August the 25th, 2022.
COVID.
We've gotten some good questions, and if you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get to them to the next time. But in the world of COVID, things are actually pretty good. As I said last week, I'll say again this week, we're at about the best time we've ever been in the pandemic. In the world, the number of cases is going down, and there's no real increasing hotspots in the world. There's still a fair amount of disease in Japan, South Korea, and Taiwan, but that's starting to come down. Australia and New Zealand, which had quite a few cases in the last few months, is also starting to decrease. And really, in the rest of the world, there are not really a lot of hotspots. We worry especially about very populous areas like China, India, and Africa. And none of those areas are seeing big increase in disease. In fact, there's a really low amount of disease in both India and Africa. And that's good news. We're not seeing any new variants in the world. BA5, which is so very contagious, is there's been no new variant that comes out which is more contagious, and thus almost all the infections are now BA5, where there's nothing on the horizon like a BA6 or something following Omicron, and that could be really good news that BA5 may be the final variation of COVID. In the US, cases are going down, hospitalizations are down, and deaths are down. There's a little bit of a hotspot in Tennessee, Kentucky, and Mississippi that we're watching, but that does not seem to be spreading to the rest of the country. That disease is, again, mostly BA5, so we're not really seeing any new variants in this country. In Oregon, the number of cases, hospitalizations, and deaths are all decreasing, and that's a good sign. In Douglas County, we're also seeing a declining number of cases. Hospitalizations are down, but remarkably, all of the hospitalizations today were in people who are not up to date on their vaccines. This has been just so striking over the last 8 weeks that those people are up to date on their vaccines. Very few hospitalizations and almost no deaths. We've had about 20 deaths in the last few months, and those have been overwhelmingly in people who are not vaccinated at all or vaccinated not up to date. So again, the vaccine really does seem to be working in preventing hospitalizations and preventing deaths. A couple new things on the horizon. One is about the rebound, and we had a question about that. So the question is, tell us, what does this rebound mean? So what we're seeing is people get the disease, typically have a relatively mild case, get better, and then about a week later start to have symptoms again, and sometimes can test positive again. Early on, we thought this might be related to the Paxlovid, but it seems to be related to the BA5 variant, because when Paxlovid was tested against Delta back last year, there was very little rebound. And now we're seeing rebound in people both who take Paxlovid and in those who don't take Paxlovid. So it does not seem to be related to the Paxlovid. It really seems to be related to the BA5. And this, again, is not surprising. BA5 really seems to be able to evade the immune system. So we're thinking that people might be able to get BA5, get over it, get the rebound, a few months later, get it again. And so BA5 really is a nasty one in that way. The good news is we're having a new bivalent booster. So bivalent means it has two antigens, and it has both the ancestral strain and has an Omicron strain in it. So it should give us good protection against reinfection with the BA5. We don't know exactly who's going to be eligible and when it's going to be available, but the thought is it's going to be available sometime in September, and that people 12 and above or 18 and above will be eligible. And if indeed it's as good as it looks to be, the recommendation would be that everybody should get a booster. And if everybody got a booster and it really did provide this protection, well, what we should see then is that this disease really will, either if it doesn't die out, really go down in the amount of disease. In addition, this fall, we're expecting a moderately bad flu season. So what happens with flu is it comes around each year, people get it, they boost their immunity either from the disease or from the vaccine. Well, in the last 2 years, we've had very little flu disease, as well as a decrease in the number of people getting a flu vaccine. So the number of people who have good immunity against flu is really going down. So we're really recommending people get both a flu vaccine booster and a COVID vaccine booster this fall. The other issue that we had a question about is about monkeypox, and we've heard a little less about monkeypox in the last week or two. Monkeypox is an orthopox virus in the same family as smallpox, but much less serious and much less transmissible. This disease has been in Africa for a long time. In May of this year, spread, and it spread mostly among men and sex with men, and has now come into the U.S. We've seen no cases in Douglas County, a little over 100 cases in Oregon. The good news with this is that there's a vaccine for this, which is effective either before you've been exposed or even effective in 4 days after you've been exposed. So really quite effective vaccine that's available. And this one really does require close contact. So unlike COVID, where you could get this at a restaurant or get this at the grocery store, there's no evidence that this spreads except by close contact like you'd have with sexual relations or with close contact like you'd have in a household. So the good news is I don't think we have to worry about going to school or going on a bus or going in the store. I don't think you're going to get monkeypox that way. The other question was, is this a sexually transmitted disease? Well, this disease transmit by close contact. And so if you have close contact in any way, you could get it. So you could get it certainly through sexual contact, but you could imagine you'd have close contact maybe on a sports team. You could have close contact, if you had a hot tub party. So you could have close contact in other kinds of ways where this disease would spread. So again, our recommendation is that for people, evaluate their close contact with others who might have this disease. And for people at high risk, to give us a call because we do have vaccine, which is effective against monkeypox. But overall, the news is great. We're coming to the end of the summer. If we look at other countries, they are having a declining amount of disease. So I would think that we're going to have a relatively good end of August and September. And then when the bivalent vaccine gets here in September, I strongly recommend that anybody who's eligible for that vaccine gets it. Again, this is Dr. Bob, the Public Health Officer for Douglas County. We'll see you again next week. Thank you.